okay. Better.
Yeah. This is better.
Yeah.
And if you stand there, sit there, then you cover the.
Yeah, true. Now we are visible in all three windows.
This is a little dark here. Why?
Where? This
part. That's better.
I'm sorry. Hello, everybody. Hi, people who all are joining. Lot of people joining. I'm surprised. Do it just this. Okay, perfect. Hello, everybody. Hi. आज विमेंस डे है और आज हमारे साथ डॉक्टर लीना है.
Hello.
She is a gynecologist. If you have any questions, अगर आपके पास कुछ भी questions हैं related to women's health, आप pregnancy plan कर रहे हैं, periods में काफी pain होता है या और भी जो भी problems हैं related to women's health, आप कुछ भी questions पूछ सकते हैं, comment कर सकते हैं, आपके questions का मैम answer करेंगी. And वैसे already हमारे पास काफी questions हैं जो हम पहले डिस्कस कर लेते हैं so that हमारी ऑडियंस को आइडिया हो जाएगा. Open this. Any message you want to give?
Happy International Women's Day to all of you. And I think ये तो बहुत ही अच्छी चीज है कि हम आज इस दिन पे डिस्कस कर रहे हैं. I think काफी सारे लोगों की आज छुट्टी है. So, you as women have all the time to, think and ask your questions.
Right.
Women's Day is coinciding with Mahashivratri. So a very happy Mahashivratri to all of you. So on this very auspicious day, I think women should bother about their health, should also. And while, I would say that you should consult your gynecologist. कभी-कभी अच्छा लगता है अगर आप अपने कुछ queries हैं, आपके कोई questions हैं, आप पूछें ताकि some जिसके मन में कोई झिझक है वो भी झिझक निकल जाती है. फिर आप you can understand कि आप मुझे आगे क्या करना है. So the aim of this reach, I think, is that.
Yeah, exactly. Yeah. Plus, we receive a lot of questions that लड़कियां usually ignore करती हैं. Periods में pain होता है तो they skip to go to doctor. Like they think कि घर में कुछ जुगाड़ करके अपना इलाज कर लें. But I think it's very important कि आप डॉक्टर के पास जाएं, उस चीज को कंसल्ट करें. एंड वो एक झिझक रह जाती है. सो दैट आज आप लोग अपने जो भी क्वेश्चंस आपके मन में है आप मैम से पूछ सकते हैं. एंड आई हैव फ्यू क्वेश्चंस जो हमें कमेंट्स में आए थे, सो हम वो डिस्कस कर लेते हैं.
एक तो क्वेश्चन आपने अभी भी एक तरह से बोला कि पीरियड पेन्स है. नाउ व्हाइल पीरियड पेन्स बहुत कॉमन चीज होती है, बट अगर आप बोल रहे हैं कि मुझे हर के इंजेक्शन लगाना पड़ता है या मुझे छुट्टी लेनी पड़ती है, फ्रॉम स्कूल, फ्रॉम कॉलेज, फ्रॉम वर्क, देन समथिंग इज रॉन्ग. मतलब आपको डेफिनेटली कंसल्ट करना चाहिए, बिकॉज कुछ ऐसे कंडीशंस हैं जहाँ पे पीरियड पेन्स होने लग जाती हैं और वो ट्रीटेबल कंडीशंस होती हैं. सो एवरीथिंग इज नॉट नॉर्मल. जैसे ये सोच होती है ना कि ये तो नॉर्मल है, ये तो बस बैठ जाओ, रिलैक्स करो, डोंट डू एनी वर्क, डोंट गो टू ऑफिस, डोंट गो टू कॉलेज एटसेट्रा, स्कूल. तो ये नहीं सोचना चाहिए. वी एक्सपेक्ट यू टू बी एक्टिव इन ऑल द डेज ऑफ द month. And if you're not active, then we have to find out is anything wrong or not. So if any of you have very severe period pain which is affecting your life, then please do go and meet your doctor.
Right. So the first question we have from the follower is that is iron deficiency common during PMS? क्या iron deficiency होना period से पहले normal है या PMS feel करना?
Iron deficiency is actually a completely separate thing, but क्योंकि ये इतना common है, so you find girls who are having heavy periods, who are having irregular periods, when we check them up, we find कि साथ साथ उनको iron deficiency anemia भी है. You would be surprised to know that the number one problem that is facing especially women is iron deficiency anemia. And that is now they have found out कि ये सिर्फ खान पान के कारण नहीं है. It can be because of inherent absorption जो हमारे खाने से होता है, iron वो कम होता है versus people in maybe जो बाहर की कंट्रीज हैं, तो एंड प्लस वी हैव अ प्रिडोमिनेंटली वेजिटेरियन डाइट, लाइक इट और नॉट, आई मीन सो मेनी ऑफ अस आर प्योर वेजिटेरियंस. सो एक वो रीजन है, साथ में किसी के हैवी पीरियड्स हो रहे हैं, देन वर्म इन्फेस्टेशन, बहुत सारे कारण होते हैं. बट येस, यू आर राइट दैट आयरन डेफिशिएंसी एनीमिया इज वेरी कॉमन in women these days. But to say that there is a connection between iron deficiency anemia and PMS, ऐसा नहीं है. It may be just coincidental.
Okay. वैसे आई एम श्योर कि आयरन डिफिशिएंसी पीरियड्स में तो बहुत ज्यादा रिफ्लेक्ट करती होगी.
Absolutely. People who have this problem, when they come to us, we find कि साथ they are iron deficient. In fact, you'll be surprised. People don't know कि वो उनको iron deficiency anemia है. और कई बार when they are pregnant, first visit, first contact डॉक्टर के साथ होता है, और जब हम उनको चेक करते हैं तो पता चलता है कि वो स्टार्टिंग ऑफ प्रेगनेंसी उनका हीमोग्लोबिन इतना कम है.
That is an issue. So the second question, is it possible to control or get rid of thyroid?
Okay, now see, thyroid जो होता है, जो hypothyroid होता है, जिसमें एक हार्मोन होता है, उसका स्टिमुलेशन कम मात्रा में होता है, which is the more common. दोनों होते हैं, हाइपो भी होता है एंड हाइपर भी होता है. अब ये देखा गया है कि मोस्ट ऑफ द हाइपोथायरॉयडिज्म जो हम आजकल देख रहे हैं इज बिकॉज ऑफ समथिंग लाइक एंटीजन एंटीबॉडी. इट इज नॉट बिकॉज वो खाने में आयोडीन उनका कम है या कुछ रिलेशनशिप विद द फूड और एनीथिंग. इट इज बिकॉज ऑफ समथिंग कॉल्ड एन एंटीजन एंटीबॉडी रिएक्शन. और ये चीज ना कैन बी हेरिडिटरी, इट कैन रन इन द फीमेल साइड ऑफ द फैमिली, या इट कैन हैपन पर से. I mean, you can have a person की 30 years तक उसको कोई प्रॉब्लम नहीं थी, उसका थायराइड बिल्कुल ठीक था, और अब जाके उसको हाइपोथायरॉयडिज्म हो रहा है. So to say that you can completely get rid of it, well, in some cases बिल्कुल कंट्रोल में आ जाता है, तो they can be given break free period, like साल 2 साल etc. But in some people, small amount of thyroid hormone is required, maybe throughout the life.
And what if thyroid is genetic? Like
so yes, many people होता है, तो we keep telling them कि annually अपना check कराते रहो.
Exactly.
So that it is picked up, to picked up. So when we come to that is, I feel कि everyone आज के time में एक annual health check जरूर कराना चाहिए. कुछ जाता नहीं है. I mean, ऐसे I've heard people saying कि क्यों कराना, मुझे तो कोई प्रॉब्लम है नहीं. एनुअल हेल्थ चेक का मतलब है कि आप अपना चेकअप कराओ when you feel that I am all right. Exactly. But you should know that you are actually all right,
Right. But people think कि कुछ हो नहीं रहा है, कोई सिम्टम नहीं है, तो कोई प्रॉब्लम ही नहीं होगी.
अक्सर वही होता है कि अगर प्रॉब्लम होती तब हम डॉक्टर के पास जाते हैं ना. हम ये नहीं सोचते कि I could be harboring a disease without myself knowing about it right now.
Exactly, true.
So
जब प्रॉब्लम बड़ी हो जाती है, then
तब जाते हैं.
Exactly, that's true. Next question is, what happen if fibroids go untreated?
Okay.
What are fibroids?
So fibroids, are like we call them benign tumors. Very, very common. Benign tumors का मतलब होता है they are not cancerous. They are, you could say, tumor is, abnormal lump or an abnormal growth which is there in the uterus. So अब क्या होता है कि now, you would be surprised to know this, that, fibroids have been there since the time of mankind, since the time, the first civilization. In fact, the mummies, the Egyptian mummies, when they took them out, they found, that they all had fibroids. So it's like that old. So sometimes we tell our patients when they have small fibroids and they're worried, we tell them they're like gray hair. As you grow older, your uterus can show fibroids. Now, that may be the case, but yes, in some cases fibroids do cause a lot of symptoms. Some of them grow huge, so they affect, they start causing pressure symptoms. तो फिर वो डॉक्टर के पास आते हैं कि भाई हमें कुछ लग रहा है. They may have बिल्कुल normal menstrual cycles, but the commonest presentation of fibroids is जब उनको बहुत heavy periods आने लग जाते हैं. So the lady comes to us, we examine her, we find that she's got this one large fibroid or 2 or 3 multiple fibroids, and she's very surprised because हो सकता है कि पहले उसको कोई सिम्टम्स नहीं थे, अभी 2-3 महीने से शुरू हो गए, as they grow bigger they start causing symptoms. So fibroids are very common, number one. Number two, they may cause no symptoms or they may cause symptoms, and we have to treat it accordingly. So it is a case to case basis how we manage them. दवाई देना है या सर्जरी करना है या उसके ऊपर वॉच करना है, मतलब वो सारा डिपेंड करता है.
And can they be treated or can they be cured?
Yes, why not? They can be. There are many ways now of decreasing the fibroid size, correcting the problems that are caused by the fibroids, and zaruri nahi ki everybody needs to get the uterus removed, you know.
Okay.
So they can be treated.
That is also a case. कुछ cases में होता है?
Yes, बिल्कुल. Okay. बिल्कुल. The big fibroids आते हैं, then ultimately we have to remove the uterus. Okay. But before that stage, if they come early and they are causing some problems, we can treat them what we call in medicine conservatively. मतलब हमें uterus निकालने की जरूरत नहीं पड़ती है.
So the next question is really nice कि HPV vaccine के benefits क्या हैं?
Okay, I'm very happy जिसने भी ये question किया है. Who has given this question?
Her name is Chetna SK.
Okay, Chetna. Okay. Yeah. Chetna, that's a very nice question. I think ये तो burning topic ही है about the HPV vaccination, and as you all know कि अभी our finance minister has announced that it's going to be free for girls between 9 and 14. Yeah. And the world over has recognized the benefits of HPV vaccination. Now मैं बस एक चीज बताना चाहती हूँ कि काश हर कैंसर के लिए हमारे पास एक वैक्सीनेशन होता, बट हमारे पास नहीं है. सिर्फ ये एक कैंसर है, सर्वाइकल कैंसर, बच्चेदानी के मुंह का कैंसर, जिसके लिए अब हमारे पास वैक्सीनेशन है.
राइट.
सो वो इसलिए बनी है बिकॉज कैंसर के बहुत सारे कारण होते हैं, बट ये जो कैंसर है, सर्वाइकल कैंसर, इसमें पाया है कि जो एक वायरस होता है, इसका नाम है ह्यूमन पैपिलोमा वायरस, दैट इज द पॉजिटिव ऑर्गेनिज्म. ओके. एंड देन दे फाउंड कि every woman by the age of 25 or so has been exposed to this virus. Okay. It sounds frightening. Yeah. डरने वाली बात लगती है, बट ये जो ह्यूमन पैपिलोमा वायरस है, it also causes those small warts. So it is basically a sexually transmitted virus. It is very common, but in some people this virus stays, and in some people they are able to over a period of time throw out this virus from their body. Okay. ठीक है. तो जिसमें ये HPV वायरस रह जाता है, उन लोगों के चांसेस हैं सर्वाइकल कैंसर बनने के. Now question comes is, ये कौन से लोग हैं? हाँ, there are some categories, some thing where we can say okay, so and so is more chances she will, but किसी के माथे पे नहीं लिखा है कि she will be able to expel the virus or not. Okay, right. So that's why here comes the benefit of a HPV vaccine. So this vaccine protects us from this virus. And also, ये वायरस बहुत सारे हैं, ये सिर्फ एक वायरस नहीं है, इसके ना बड़े सारे सब टाइप्स हैं. Okay, so like you have 6, 11, 16, 18, उसको ना numbers दे रखे हैं. तो there are about 40 of these kinds of HPV virus, and a lot of them are known to have be the cause of the cervical cancer. Okay. ठीक है. तो अगर हम अपने आप को प्रोटेक्ट करें by taking the vaccination, so almost 80% of the types are covered by this vaccination. Wow. So easily this vaccination is very important. So those of you who haven't, and I'm very glad this question has been put across, because those of you who haven't taken it, please go and take it. It is available. Right. And now it is, come in the government hospitals also. It was there with us in private hospital. It's still there with us. So you got lots of choices of kinds of vaccinations you can take. Okay. And depending on your pocket, go ahead with it.
And what are the kinds of HPV vaccines?
So we have one which is for the 4 subtypes, and we have one which is for the 9 subtypes.
Okay. Right? And what is the difference?
So the difference is, you see, the 4 subtypes was there for a very very long time because they found कि यही हैं जो सबसे कॉमन सबटाइप्स हैं जिसके कारण सर्वाइकल कैंसर होता है. देन दे सेड व्हाई नॉट एक्सटेंड इट. तो इसका ना स्पेक्ट्रम एक्सटेंड करके दे एडेड 9 वायरसेस. उसमें दे वर मोर व्हिच वर गिविंग अ कवर अप, है ना. जैसे मानो मैंने कहा 70 to 80%, देन व्हाट अबाउट द बैलेंस 30%, वो भी कवर अप हो रही है, प्लस is giving added protection from the benign warts, etc. So when I say that you want to take added protection, why not you take it? Exactly. And as early as possible. Please don't wait. So I have this very common query that kahin likha hua, I think in the NHS abroad it's written 50 to 26. In India it is, the age group is 9 to 45. 9 years की लड़की से लेके 45 years के age तक, anybody and everybody, I mean every woman can take it.
Okay. So then you must take it.
So you must take it.
True,
I mean you will fall in that age group. And whenever you go for your health checkup, do when you take the health check packages, ask for the one where you can have a pap smear included. Okay. Because I've seen कि लोग बहुत झिझकते हैं अपना पैप स्मेयर कराने के लिए, बट आई थिंक दिस इज वेरी इंपॉर्टेंट. यू मस्ट प्रोटेक्ट योरसेल्फ. यू कैन गो फॉर इट once in 3 years and get it done, but you must get it done along with taking your vaccination.
So you must get the HPV vaccine. Even I want to add it कि आज सुबह ही there's a Bollywood actress, her name is Dolly Soni, and she died of cervical cancer only.
There are so many,
so many cases happening, and still people are not aware of these vaccines. That's sad.
Someone has asked about pelvic cancer.
Okay, so people have asked about pelvic cancer. May I know the name of the person? It's Rupali. Recently we heard about this pelvic cancer. Can you please explain about it?
Right. So
Rupali.
Yeah. Rupali, see, pelvic cancer is a very broad category. That's basically comprising of everything that is there in gynecology. So you can have pelvic cancer, say you can have the uterine cancer, you can have cervical cancer. The difference is uterine cancer is the cancer of the womb, that is the uterus, and cervical cancer is the cancer of the mouth of the uterus. Right. And then you can have fallopian tube cancer, you can have ovarian cancer, you can have vaginal vulval cancer. So all these come under the broad category. But when we actually see the percentage, then we find that cervical cancer is, the number 2 cancer.
Okay.
For women, commoners.
Okay.
And the number 1 position is taken by breast cancer. Right. So these two are the very common cancers. And out of the other cancers, I can just say that ovarian cancer is the most deadly because ovaries, aapko pata hi hai, they are lying inside the abdomen. So it spreads very fast. That is there. And uterine cancer, that is endometrial cancer, is like, whenever I have a patient where I have diagnosed endometrial cancer, I always try to, boost her morale by one which has the best prognosis.
Right.
So, uterine cancer. So, coming back to the topic of pelvic cancers, I think cervical cancer is the most common.
Right. So we have next question, which is how often can one take contraceptive pills, and does it have major side effect in long run?
So I just want you to understand that when you go by the monophasic, biphasic, that is the regular oral contraceptive pills. So if you are a non-smoker, if you are less than the age of 40, you can take it as long as you wish. Now you may find that little difficult to believe, but it is a fact that oral contraceptive pills are a very very easy method of, and very reliable method of contraception. And you can take it. Your only problem is that you should remember not to miss taking it.
Right.
And the thing which I am being asked by a lot of patients is they are more fond of taking the emergency contraceptive pill.
Yeah,
I just want to tell them that emergency contraceptive pill is only for emergencies. It's not like you take it 4 times or 5 times in a month, because we have a lot of problems when people take ECPs. So if you are a woman who has a regular, sexual life, an oral contraceptive is the best. Remember, oral contraceptive pill के और भी एक्स्ट्रा फायदे हैं. एक तो पीरियड्स रेगुलर हो जाते हैं, लेस चांसेस ऑफ फॉर्मिंग सिस्ट इन द ओवरी, राइट. तो ये जो पीरियड पेन है वो भी नहीं होता है ना. एंड क्लॉक वर्क लाइक पीरियड, सो शी इज प्रिपेयर्ड फॉर इट. शी नोज कि आज आने वाला है पीरियड, सो शी इज वेल प्रिपेयर्ड फॉर इट. That is there. It also protects you from other conditions, like we have endometriosis.
Right.
Some people have that coincidental problem. So OCPs are really very good. Basically याद रखना है कि हमें उसको लेना है. And more important, then the contraception is in the hand of the woman.
Right.
I mean, the decision to take or when to stop and when to take is in the hand of the woman, and it is very, very reliable. I mean, almost gives you 100% efficacy.
But does that affect your health, like in long run?
No,
Not at all.
No, not at all, not at all. In fact, if you remember, now almost 22% women are girls we are seeing who are coming to our OPD are showing PCOS, right? And in PCOS, one of the easiest ways of bringing one of the bad hormones down, we call LH levels, is by giving them oral contraceptive pills.
Okay.
It's one of the simplest ways of ensuring that she gets regular periods. She has less of that hair which you see sometimes in PCOS girls, and clockwork like periods, regularizing the periods in cases of polycystic ovaries. So I've when we talk about OCPs, you must remember that there are many varieties now. There are low dose estrogen, high dose estrogen pills. So go to your doctor, let your doctor choose that oral contraceptive pill which is right for you. They do not cause you, nowadays the new pills which have come, they are not causing any weight gain, which is really a problem. They barely cause any nausea and vomiting. They are very well tolerated. And in fact, I just want to tell you one thing, that now studies have found that if women use OCPs during their lifetime, they have a less risk of developing ovarian cancer.
Okay.
So जब हम चीज देखते हैं ना बेनिफिट्स, पहले हमें उसका बेनिफिट सोचना चाहिए, ना कि हम हमेशा शुरू हो जाएं कि भाई इसके नुकसान क्या है. बेनिफिट्स जब किसी चीज के ज्यादा होते हैं नुकसान के बदले, तो हम उस चीज के ऊपर ज्यादा ध्यान देते हैं. तो इसके बेनिफिट्स बहुत ज्यादा है एंड सिंपल है. एंड इट इज नॉट लाइक आपको कोई झिझक नहीं होती लेने की. यू डोंट हैव टू थिंक अबाउट एनीथिंग, एंड यू आर वेरी सेफ. Basically, safety is much more important.
Right. And what do you want to say to youngsters who take pills just like that, अपने आप ही chemist से जाकर ले लेते हैं?
See, if they're taking the oral contraceptive pill in the right way, in the right way, then I would say that it's perfectly all right. See, your life is, we are in the 21st century. Everyone has their own life to lead. You should not end up having an unwanted pregnancy. You should not end up having a sexually transmitted disease.
Exactly.
Okay, these are the two things. अपना health के ऊपर ध्यान रखना है और अनचाहा गर्भ नहीं होना चाहिए. Because see, all said and done, it is the woman who can become pregnant, not the man. So the woman has to protect herself. That is the most important thing. Having said that, emergency contraceptive pill should be used only as an emergency. So I've had people who've had 4 unprotected sexual intercourse in 1 month and taken every time the emergency contraceptive. उससे क्या हो गया, उनका cycle इतना लंबा हो गया. She went into a panic, and then because of the high dose progesterone, she started having feeling heavy in the breasts and feeling really miserable, bloated. So I had to tell her this is because of the high progesterone levels circulating in the body. Medical, है ना. तो emergency contraceptive लेना है तो maybe once in a month लेने की जरूरत पड़ गई. But yes, if they take regular oral contraceptive pill, इसकी जरूरत तो पड़ेगी ही नहीं ना.
True. तो नहीं लेनी है. True. Okay. So another question is कि I have one fallopian tube, and do I need to have do I need to take medication to conceive?
Okay. Now, obviously, you've had an ectopic, and see, you must understand that this is like the other fallopian tube. If it is patent, you must remember, like God has decided that human beings will have two kidneys. एक फेल होगी तो दूसरा काम करेगी. सिमिलरली दो फेलोपियन ट्यूब्स हैं, क्योंकि एक फेल हो गई या निकालनी पड़ गई तो दूसरी फेलोपियन ट्यूब काम कर रही है. Now, I just want to tell you that I have so many patients who have, conceived beautifully even with one fallopian tube. So, निराश तो number one नहीं होना है. अपने आप को देखना है कि you don't get any kind of infection again. Keep a minimal gap. Consult your doctor.
Right.
कि वो जो बची हुई ट्यूब है वो healthy है, and plan your pregnancy. And as soon as you're pregnant, have yourself checked that again it's not a repeat ectopic, that is a pregnancy in the fallopian tube.
Okay.
So since you have only one fallopian tube, it's a precious thing, no doubt. But like I said, that I have so many people who have conceived and have had 2-3 children with one fallopian tube. So this is a very I think the person who was given this question is a little perturbed, is a little upset because she has only one fallopian tube. I just want to tell her, don't get so worried at all.
Okay. So the next question is, what is it risky to take painkillers during menstrual cramps?
Well, not at all. There was one medicine which is now people have said there have been some studies which they have sort of banned use of mefenamic acid, that is meftalspaz. I think it had become such a household name. Everybody used to keep a packet of meftalspaz with them.
Even it was so common in our office also. Everybody used to have one strip.
So that was the salt, which was considered bad. It's not per se preventing, you don't have to sit and suffer the pains.
Right.
So there are other medicines now. We have, many medicines. Simple medicine which all of you can procure is the good old Disprin, which is available, right? Or a Combiflam.
Okay.
बस यही देखना है कि कुछ खा के लेना. You should not get gastric upset.
Right.
So you can use these medicines, and you don't need to, just because meftalspaz is now been restricted and been told not to take, doesn't mean you have to sit and suffer period pains.
Sure.
So there's so many other medicines you can take.
True. So another question is, how to control weight during menopause?
Oh, that's a very nice question. So, yes, there is some, because certain hormonal changes are there, and there does occur some amount of weight gain at the time of menopause. But we shouldn't lose heart. We have to keep a healthy lifestyle. We have to, continue with our exercise. We have to be very particular because, the metabolism starts falling. You are not as active as you used to be. Add to that, there is those hormonal changes which also play a role. So both tend to add to weight gain. But like we said, that menopausal symptoms, the kind of suffering which women have can a lot be decreased if one keeps a good exercise regime, keeps a balanced diet. Same goes with keeping the weight under check. So this is foremost, important at the time of menopause, to keep yourself active and keep yourself having a good balanced diet. And nowadays there's so many, dietitians who are available to us, so we can जैसे कहते हैं ना, अपने मनपसंद खाना, अपने variety of खाना के साथ we can keep a good diet at the time of menopause.
And a lot of women suffer perimenopause also, right?
Yes. Perimenopausal, hot flushes, night sweats, irritability, feeling bloated, and add to that the weight gain feeling is there. And there's a lot left undiscussed about the mental status of women at the time of perimenopause. You have to understand that all her life the lady has been looking after small children. They've grown up and sort of gone to college, gone out to work, etc. And now when it comes a time to sit back and relax and maybe enjoy a good life, she suddenly finds that as a result of the hormones waning, she gets she starts feeling hot flushes in the night. She's not able to sleep, so the next day she's not able to go to office, and most
right.
women at this time are, at the top of their careers,
Right.
So you can imagine the late 40s and in the 50s, they're all company CEOs and heads of principals of
Yeah.
schools and heads of departments, etc. So to be facing problem with the body, that becomes a sort of unacceptable at that time, that
Yeah.
you're getting hot flashes, you're not able to sleep in the night.
Yeah.
So what I would say is keeping, again we come back to diet and exercise. And now there are a host of medicines available, and I really don't even want to call them medicines. There are lots of preparations and hormonal preparations which we give for a very short period of time to tide over this period. Thankfully, it's not forever and ever.
Right.
Usually the first 1 to 2 years, just prior to the actual date of the last menses, or you may say going up to 1 to 2 years after the final menstrual cycle, some women may have problems, and there are lots of medicines which are very safe and which can be given to them.
Right.
They don't need to suffer. Please come and contact your gynecologist.
So if you're losing weight during your menopause, you just have to adapt the diet.
Yes.
Like you have to control your diet. And is it okay for them to do physical activities like gymming or doing yoga? Because I have read somewhere कि menopause के during the menopause आपकी weeks bone भी काफी weak हो जाती है.
Yes. So again, bone loss takes place in the first 2 years of menopause, and it goes really fast for some people, especially who have genetic predisposition, So it is advised that at that period of time to keep a very good, diet rich in calcium and vitamin D. So that you don't lose as much. Plus exercise, like you mentioned, the thing with yoga and gymming, they should continue, because actually that will help, prevent bone loss.
Okay.
You got my point. Of course, we are not telling them to do hard gymming unless you are used to. Like supposing you are a marathon runner, you can continue to do that at menopause. But if you are reaching menopause and you already have weak legs, or you already have a problem with the knees, then it is better to go for light exercises at that time, so that you don't suffer from more and more bone loss at the time of menopause. Here I would just say that all of you who are nearing the menopause, that means, you see, the age of menopause is not defined. It in Indian scenario, it is between the age of 46 to 53. So, and you just ask your mother or your elder sister, it runs in families, mother's side of the family,
Right.
So like late menopause is seen in a lot of families, and early menopause in some families. So both have their own risk factors. The earlier you get menopause, the more chances that you lose bone calcium.
Okay.
So you're less likely to have more symptoms. Late menopause, while you may have, you protect your bone health and your cardiac health, but late menopause means you run a higher risk of the cancers, and problems, of course. So either way, you must at the time of menopause consult a doctor, because there may be individual problems which are bothering a person.
Right.
So she should go and meet the doctor.
Okay. So another question is, can only PCOD be the reason behind chin growth in women?
No, there can be many other reasons. Like you can have something called anovulation. That means the egg is not, rupturing, and that can also cause. You don't have to be a, PCOS patient to have that. And then there's many other disorders which can cause hair. Thankfully, most of the disorders which cause, this kind of light hair is just what we call, no cause, idiopathic, we call it.
Okay.
So it's not that everything is put that this is because of PCOS.
Yeah. There are a lot of reels we see on Instagram, Facebook, everywhere. They just show us a lot of, very false symptoms. And people trust it.
Yes.
They think कि यहाँ पे बाल आ रहे हैं, यहाँ ज़्यादा hair growth है because of PCOD. Similar question है, why period days decrease to 1 to 2 days from 4 to 5 days? Is it a sign of PCOD again?
Yes, it can be. So if from 4 to 5 days it suddenly come down to 1 to 2 days, please go immediately to your gynecologist. We need to check.
Right.
So If it's just a one-off thing, one
Hmm.
cycle, then
Hmm.
it can be some kind of stress, like you've gone out of the country or you're gone
Traveling.
to some college, you
Hmm.
know, where and your food diet and habits have changed
Right.
drastically, and or there is an exam approaching. You know, you
Okay.
remember when there is an exam approaching, you suddenly got the period and
Yeah.
not supposed to come because
Usually
you're
it
so
happens
tense.
when you're traveling.
Yeah, when you're traveling,
Yeah.
absolutely. So if it is a one-off thing,
Hmm.
जैसे एक menstrual cycle में आ गया, अगले बार तो ठीक हो गया.
Hmm.
बट अगर कंटिन्यूअसली आपने देखा है कि 4-5 डेज से आपका एक 1 or 2 days आ गया, please go and get yourself checked. There can be many diseases which can be, you know, silently coming up, and they can be a cause of this. And yes, PCOS is one of them. Yes.
Okay. Okay. So the another question is, after 30s, what should be done for normal pregnancy?
Okay, now see 30s. When you say 30s, are we talking about 31 or 35?
Yeah, we're 30s in the sense, I think
Early
early 30s, right?
Okay. Early 30s, by and large, we don't need to panic at all, because, you know, people are getting married late. They want, you know, and I'm talking about women. Women are marrying late. They want to establish themselves in their careers. They want to complete their education, and only then they want to think about marriage. And once there is marriage, they don't want to rush in to have a baby immediately. They want to adjust to their life, etc., which is absolutely, I think, fair. I mean, you know, the times are gone when people got married at 22 and had a baby at 23. As so, we don't see. Most of the people are. So, early 30s, I don't think it is anything to get worried about. You're perfectly all right, 31, 32, having a baby. But just a word of caution, 35, you know, the you know, cutoff, or you can say, is 35. Because the biological clock is not waiting. So after 35, we see a number of women where, you know, the eggs which were there in their ovaries, you know, the number of eggs, they start falling. So they have a little difficulty they may have a little difficulty in conceiving. Okay. Now, when I say that, I don't mean that each and every one who crosses 35 is going to have a difficulty in conceiving. But it has been also seen that the percentage risk of abnormalities that starts rising, you know. Okay. So we, you know, when you talk about 1 in 10,000, then it becomes 1 in 8,000, 1 in 2,000. Okay. So statistics start catching up. So it's very common these days to have a 37-year-old who got married at the age of 36 or who's coming at 37, who's got a perfectly normal egg count, and who perfectly normally conceives and has a baby at 38. You know, however, a word of caution, don't go by you know, that, oh, it happened with her, so, you know, everything is fine. Do get yourself checked if you're planning to go, you know, you're not planning to get married by the age of 35, because yes, small amount of you know, some percentage of women after the age of 35 do have a poor egg count, and they may have problems. Okay,
then you must, if you are planning a pregnancy, you must visit a doctor first.
Yes, you must visit a doctor.
True. So another question is, can eating folic acid and concivil tablet cause acne?
No, why should it? Folic acid is generally given for someone who's planning to conceive. Okay. So it doesn't accelerate acne. Okay. Acne can only be, you know, it's triggered by, you know, certain hormonal imbalances. And it is, you know, the second hormone in the cycle, the progesterone, which generally causes acne. So it's not folic acid and not conceival.
Okay. So another question is, difference between oral and emergency contraceptive.
So the biggest difference between both of them is the regular oral contraceptive pill covers the entire cycle. Right. So that means you have to start taking it from the second day of the menstrual cycle. And regardless of when you have intercourse, you're supposed to take it for the entire duration, which is mentioned on the strip, like starting from the second day and going up to the entire strip of 21 tablets or 24 tablets, depending upon the particular brand. You cannot miss a single tablet, regardless of when you had intercourse. So it covers the entire cycle. Emergency contraceptive, on the other hand, is only taken once there has been an act of unprotected intercourse,
Okay.
So what is recommended on the thing is, like, supposing you were using a backup method, like maybe a barrier, a condom, and there was a condom burst. So you are very worried that this particular episode could lead to a pregnancy.
Right.
So within 72 hours, you have a emergency contraceptive pill.
Right.
So this is, the word itself suggests that it is for emergency. So if there's very infrequent intercourse, then it is okay. Or if there's an emergency, like a backup method has failed.
Yeah.
But for a person who is having a regular sexual life, emergency contraceptive is definitely not the method of choice. Yeah.
Right.
We've seen a lot of pregnancies happening with the emergency contraceptive pill, because people have taken it, after ovulation has occurred.
Okay. Right.
So, what
Then it
I'm
might
just saying,
not work.
yeah. But oral contraceptive pill is definitely any day much, much better. But the only drawback is daily khani padti hai. So, some women don't like taking it. I don't know why, because it's really a very good method. But some people don't like taking it. Mujhe roz khani padegi. Boli.
So, you mentioned ovulation day. So, how the chances of getting pregnant increases on ovulation day?
Okay. So, supposing you have ovulated, the egg is passing from the ovary and coming via the fallopian tube to the uterus. Right? Now, at that particular time, or the sexual act that was there, if supposing the egg is already there in the fallopian tube, and the the act of sexual intercourse has already happened, and you can say the fertilization has already taken place in the fallopian tube. In that case, when the conceptus or the fertilized gamete comes and forms, in very simple terms, the baby is implanted in the womb, then you are giving this medicine. It is nothing but a high dose of progesterone. It won't do anything. In fact, it will actually protect the pregnancy.
Okay.
You understand?
And people
So
take
that's
it to,
why,
cancel the pregnancy. Right.
yeah. So that is in fact mentioned also in the literature, that you should be very clear, and you should take it as early as possible. Because the chances of interrupting that, pregnancy happening becomes lesser and lesser as you go beyond the period of ovulation. Yeah.
True. So, the last question is advice for planning pregnancy.
Okay. So, anyone who is planning a pregnancy, well, you should be physically and mentally ready for the pregnancy. That goes without saying. And by physically, I mean, go for certain basic tests. You must have your hemoglobin. You must be more than 11.5 gram percent. You should not be anemic. If you are, you should find out what is the cause, because the burden of pregnancy will be a lot on you if you get pregnant when you are anemic. You must check if you are pre-diabetic or you are diabetic, because it's very, very common these days. Get your thyroid level checked. Again, as I said, there may be no symptoms. And the cutoff, for thyroid levels is much lesser for a woman who's planning a pregnancy. So take the appropriate advice after you get it checked, your thyroid. Also get your thalassemia profile checked. And there's a lot of people who are thalassemia minor who don't even know it. They just keep saying hamara hemoglobin to hamesha kam rehta hai, but actually their hemoglobin is less not because they are not taking good diet. It is less because they have something called thalassemia. It's a trait. It's called thalassemia minor. In that case, it's very important that we check the husband's test also for thalassemia, because if both are thalassemia minor, then there are chances that they may produce a thalassemia major baby, which is a very not a, it's a dangerous condition. So they should
have
know.
to take blood after 20
blood, and it's not thalassemia major, when it's diagnosed, it's one of the indications for going for a termination. So people should know their thalassemia status, and that is important, and all this should be done before you plan a pregnancy. And apart from that, if there are any other problems, like she could have blood pressure problems from before, or she may, have asthma problems, or she may be on some, skin medication. She may be on, some other medication which is to be avoided in the early months of pregnancy. Or she could be on some, antipsychotic, mental disorder medicine. We are seeing a lot of people coming. So whatever it is, all these medications should be checked by the doctors to find out what is the right dose to be given when a woman plans a pregnancy. Now, don't forget the mental health also. I think that's also very important. You should be ready for an addition into the family, which is going to put a lot of stress onto your family ties. So I've seen a lot of people, who are actually not settled in their married life, and suddenly somebody says, okay, you have a baby and everything will settle.
बच्चा कर लो, सब ठीक हो
सब
जाएगा.
ठीक हो जाएगा. Exactly. Actually नहीं होता है. बच्चा करके सब कुछ गड़बड़ हो जाता है, because it's a lot of stress on your body, both physical and mental. You've got to be both strong enough as a couple to deal with a third person in your life, because there's a lot of demands on your body.
Right.
So having said that, I think once you get yourself checked, both physically, you understand what it means to have a baby, well, go ahead with it. And yes, a little word of caution, the ideal weight. Now, we are seeing a lot of women coming overweight with high BMI who are saying, oh, I want to plan a pregnancy. So I also tell them, try to lose some weight. It's very important, because you run a very high risk of developing all kinds of problems, starting from diabetes, hypertension, to big baby, and more chances of cesarean section, if you are overweight. And today's time, to give up on smoking and drinking,
Right.
and prescription drugs.
Yeah.
Okay, that's very important, because nowadays we find like people, oh, I suddenly got pregnant and, I was drinking all this while,
Yeah.
So then you have to tell them that, look, you need to have a healthy lifestyle, and nobody should also smoke in your presence.
Right. True.
So you may not be smoking, but the other person is smoking.
Smoker.
So you become a passive smoker, and that poses a lot of risk to your baby.
Yeah, we have similar question here again, that how can I prepare for a healthy pregnancy, and what should I expect during each trimester?
Okay, so the first half you've already answered, and I'm sure you have been also listening to it. The second part is what to expect in the trimesters. Well, I've got some very beautiful pictures here in my chamber, which I guide my patients, in all the 3 trimesters, how to go about it. Now, the first trimester, the first 3 months, is the period of time when there is implantation. I don't know, you probably can't see it, but it goes on like this, till 12 weeks. So that's a very important time, and in fact, sometimes a very distressful time. You have a lot of, some people have nausea, vomiting, almost in 80 to 90%, but they are lucky 10% who don't get nausea and vomiting. So like I said, it's a period of time where your body is adjusting. Right. So all your systems start working, your kidney starts working faster, the blood which is running through your body goes faster. So there's a lot of stresses on your body. So there are changes that you start seeing in the body. And at 12 weeks, it is lying where your pubic area is there. The baby is there at 12 weeks. After 12 weeks, that is the end of the first trimester, it starts climbing up, and that's when you start seeing the baby bump.
Okay.
So
12 weeks
month.
is how much? 4 months, right?
12 weeks is the completion of 3 months.
Right.
So that is the first trimester. Okay. So all the, you could say, feeling very nauseous, not feeling like eating is the first trimester. So I tell my patients, don't worry. So this is only a passing phase. Pure 9 mahine aise nahi rehne wale ho, hai na? Okay. So come the 4th month, the nausea, vomiting starts becoming lesser and lesser. She starts feeling more active. She starts eating well.
Right.
So that's when, you can tell her, okay, now please go and take your walks. And they start really enjoying pregnancy in the 4th month. Yeah. 4th, 5th, 6th, till the beginning of the 7th is what we call the second trimester. We really don't see it as, we make the pregnancy in weeks, right, which is a little easier to explain. By the end of the 3rd month, we have done certain ultrasounds where we are reasonably certain that the baby is doing well, growing both physically and genetically, proper. Then the 4th, 5th, 6th, usually these are the safer months. Like a lot of patients ask us, can we travel? So we say, yes, you can travel 4th, 5th, 6th month. They can lead a normal life also. And then before the 5th month, that is what we call 20 weeks, the baby is fully developed. It's like a small mini adult, sitting in a nice sack and cocooned inside the womb and swimming, with the movements. And so you can pick up everything. You can see the fingers, you can see the hands, the eyes, the eyebrows. The whole baby is visible by 20 weeks, which is, so that's an important landmark, because there is a scan which is done at that moment, the ultrasound, which picks up all kinds of abnormalities, and it's very reassuring when the couple sees the baby dancing in the womb. So generally by that time, you are enjoying your pregnancy. Again, 7th month, 8th and 9th month, that's the time when, if problems have to come, they start. Blood pressure, diabetes in people who are at risk, they open up, or the baby is not growing too well. So we do evaluate the mother's health at that time. She has to repeat her hemoglobin, because sometimes there is a fall in the hemoglobin. She has to get her diabetes checked, blood pressure, her weight is checked at every visit. And so the 3rd trimester is something like the 1st trimester. The demands on the body become more and more. And physically it becomes difficult for her, because she's carrying the baby, bump and walking. We call it the waddling gait. So she's walking, and then again the restrictions come that don't fall. Be careful when you're climbing up and climbing down. And usually the people who don't have a problem, they sail through it and they reach 38 weeks. Between 38 and 39 is the time we expect labor pains. So that's the time when
and do you think that all these yoga we see on like we see a lot of actors are doing gymming and doing yoga during their pregnancy, prepping for labor, does that really help in normal delivery?
So really that helps to tone the body. Ultimately delivery, or what we call vaginal delivery, depends on 3 P's. One is the power, one is the passage, and the third is the passenger. Power is the kind of labor pains you have. Passage is the bony pelvis that God has given you, right? And the passenger is, of course, your baby, right? Now, we can modify the labor pains. Like supposing the labor pains are sluggish, we can, increase the labor pains, right? That is man-made, okay? But the passage, no way. It's like an egg in a teacup. Supposing a baby is very big, okay, closer to 4 kg, and your pelvis is this much. How can the baby go into that pelvis? Stands to reason. So that passage is something nobody has any control over.
True.
And the third is the passenger. The baby position, how the baby flexes, how the baby takes a curve into the bony pelvis. There's series of maneuvers, that baby has to do as it travels down. Now, how does exercise help? Exercise helps in making the body supple. It helps, and in these exercise modules, we teach them here in my hospital also. We teach a lot of breathing, how to breathe in and breathe out. That really helps a person, and also not to be panicky. So by doing certain exercises, we help the baby to align well in the bony pelvis. So that is what exercise helps. Apart from good toning, not putting on excessive weight. Again, yoga and also some of the other exercises help. So if not too much of weight is put on,
carrying weights,
excessive gymming and carrying weight lifting is definitely not asked for. So the kind of exercises a woman can do is the yoga. All the yoga asanas are there, which are really good. Then we have certain exercises which are very specific to pregnancy. Then 3rd trimester, squats, butterfly, the duck walk, and the deep breathing in all is there. How to breathe in and breathe out. I think that is very, very important. That is taught. But a woman who takes a good walk, who is doing swimming, these are some of the exercises she can continue doing. Not hard gymming, or say maybe even going horse riding
Yeah.
or kabaddi or so those kind of
Of course.
very very high intensive sports. That is a big no.
Right.
But yoga and the exercises which are taught for the third trimester, basically to tone up the body, to ensure that you don't put on too much of weight. Because India, what I find is, the moment the woman is pregnant, everybody starts giving advice. You have to eat for two.
Even for like कि तुम तो normal delivery ही करवाना.
Karwana.
हाँ.
See, I told you par passage passenger. ठीक है? Now, what can you do about your passage? If your passage doesn't permit a 3.5, 3.8 kg baby, then there's nothing you can do about it. No?
True.
So, तुम करवाना वाला बात नहीं होती. At the end of it, what is suitable for you should be in the interest of you, your health, and your baby.
Even
that should
on the
be
doctor
there.
also it depends.
Yes,
right?
yes.
Yeah.
Yes.
You should listen to your doctor, not to your rishtedars. They're saying that normal kara lena.
You should always listen to your doctor. Coming back to that, I always feel you must trust your doctor, because believe me, your doctor wants the best for you, right? Your doctor doesn't want. It's not like something that ye hame karwana hi hai. I'm telling you, if we have patients who are like absolutely, who have put on that much, which is the right weight, the right pelvis. There's no reason why she shouldn't have a vaginal delivery. The ones who have a problem, yes, many of them going for a vaginal delivery, but there are some cases where the body just doesn't permit. So
what
they
is the
should also
right
not
weight
feel.
for that?
Okay, so the right weight again depends. If you are a very underweight lady, so if you are underweight, then we expect at least 15 kg weight gain in all the 3 trimesters to have a healthy. Decent. The right weight is between 2.5 kg to 3.5. That's the range. Okay. So that's a big range. 2.5 kg baby is as active as a 3.5 kg baby. Hai na? So it's a range. So less than 2.5, we say it's an underweight baby. That also has problems. She may be able to deliver it vaginally, but the baby can have problems. Similarly, more than 3.5, the women may find it difficult to deliver.
I was 4.
Right? Yes. So you were 4 kg.
Yeah,
right?
mother told me.
Yes. Your mother must have had a very nice, good pelvis, good gynecoid pelvis. Yeah. So having said that, it is not a single thing that we say ki aisa hi hoga.
Right.
It depends on the person to person. And by and large, we have to encourage a healthy pregnancy, a healthy delivery, and at the end of it, a healthy baby and a mother.
Exactly. That is most important.
That is most important. And again, you start by not listening to people who say you have to eat for two. You have to eat sensibly for two. Not eat for two. कोई भी 2 लोगों के लिए खाना नहीं खा सकता. मतलब I can't. Can you?
No.
So
Not
if you are eating 2 chapatis, can you start off by eating 4 chapatis? Especially with nausea and vomiting? No, but you can improve your diet. You can avoid junk food.
Sensible eating.
Sensible eating. You start eating from outside because you're going to get a tummy ache. You can start by, improving the kind of diet you're eating. So we always want people to concentrate on proteins during pregnancy, and a lot on the vitamins and iron-rich foods. So those foods are definitely not unnecessarily fattening. So people who are overweight, we expect a lesser weight gain during pregnancy. Otherwise, they're going to have a lot of problems. And people who are average, what we call a average BMI, we expect a weight gain of between 10 to 12 kg in all the 3 trimesters. And someone who's underweight can happily increase her weight to 15 kgs, and we are not very much bothered. We are quite happy about that.
Yeah, exactly. So as of now we have covered all the questions, and अगर आप मैम कुछ join करने मतलब बताना चाहते हो, especially to the audience who's watching this, आप बता सकते हो. There are like a lot of people joined us, and we are left with few, but yeah, we have covered all the questions.
I think some of the questions, they were quite similar, so I think we were able to cover that.
Exactly.
So I think one nice point which came out, of course, was how to plan a pregnancy. I think that was a message which I really wanted to share. And the other thing was about the HPV vaccination.
Yeah.
I have seen a sudden footfalls and people becoming aware about the HPV vaccination. I'm so glad because our aim, the WHO has given a call that we must eradicate cervical cancer. So our aim is that by 2030 we are in a position to join the list of those countries where cervical cancer has been completely eradicated. So if you haven't taken the vaccination, do take the vaccination wherever you are. I think all small and big hospitals have started stocking up on the vaccine, so you can go and take it. So that was a very nice question, and I think the message was quite clear.
Yeah, I hope it's a very informational kind of a session, and everybody has enjoyed it. And
yes, I also enjoyed it.
You also enjoyed
yeah.
it.
Yeah, it was enjoyable. And so International Women's Day should have a meaning in your life. If you end up, improving your health even a little bit, to spend some time on yourself, spend time. So if you can go and buy a fabulous dress for 5,000 rupees,
Yeah,
I think you can at least spend 1,000 rupees on getting your tests done.
exactly.
Yeah.
And taking care of yourself.
So be beautiful from the outside, from the inside, as you are beautiful outside.
Exactly, it's most important, because अंदर ही अगर problem होगी, then
There is no point.
there's no point. Okay, thank you everybody for joining in, and I hope आप सबके questions का answer आप लोगों को मिल गया हो, and we'll come up with more lives like this with a specialist again. Thank you.
Thank you. Thank you.
Great.
Good.